Hello, welcome to Module 3, where we'll be talking about the first of 5 steps in the EBP process, asking a focused clinical question. Before we can begin to ask a focused clinical question, we need to have sufficient knowledge on our topic, a broader contextual understanding of the factual and accepted knowledge on a disease, condition, or problem that is being addressed. Background sources provide information on this established knowledge that would not be addressed in newer research studies. What you find in newer research are studies challenging or expanding upon commonly held belief. However, if you don't know much about a condition or the standard treatment, how can you challenge or move forward? Sources for background information would include reference books, textbooks or books, EBP databases, and professional associations. I would recommend the Picot Academic Core Collection for the number of nursing reference books on that platform. Reference books are specialty encyclopedias, dictionaries, and handbooks, and Picot is my first choice. I would recommend the ProQuest eBook Central platform for chapter books. Many nursing titles recently added to our collection are found on that platform. And the ability to search within the full text of a chapter book on an electronic platform allows your research to function much as it would within a reference book, enabling you to target packages of information quickly. UpToDate is an evidence-based point-of-care medical database that provides a synthesis on topics. It's evidence-based, therefore highly up-to-date, and functions like a most recent textbook, while referencing all of the recent literature for a given topic. Similarly, Nursing Reference Center Plus is also a point-of-care evidence-based resource, providing a synthesis on topics with a definitive nursing focus for nurses at all levels of study. It contains a virtual bookshelf of reference titles right within the platform that you can consult directly. The American Nurses Association is a professional organization that provides an established voice of the profession, highlighting current issues, standards, and policies. The Library Research Guide contains a brief list of other professional nursing organizations or societies, but the appropriate association would be topic-driven. Once you have sufficient background knowledge on a topic, you can begin to construct your focused clinical question. These are considered foreground questions. Foreground questions are those focused on an individual patient, formulated with the Picot template. There are several Picot templates depending on the nature of the question.
Now that I've talked about all of these background resources, I want to make sure you know how to access them and give you a little peek at them. So go to the library homepage at library.misericordia.edu. Select the One Search tab above the search box, and then select Databases A through Z. Here is an alphabetical listing of all of our databases. I'll expand, and I will select Picot Academic Core Collection and link right out. Let's take a look at Picot. I can do a search and build a search string right within this database. I just have a broad term in. I'm going to enter diabetes. And you can look through the results and see where the entries are. And here I see one from the Encyclopedia of Nursing Research. That's mostly how I use this database, but you can go ahead and browse and look at titles. And if I go to Health and Medicine and expand, I can look at all of the nursing books in this collection. And this is why I recommended it for the nursing reference sources in here. The Encyclopedia of Nursing Research, the Gale Encyclopedia of Nursing and Allied Health, Nursing Leadership, Key Concepts in Nursing. So this is a very good resource. Let's take a look at ProQuest eBook Central. This is the book collection I talked about before. It has both reference and monographs in here. Let's do a search on diabetes. And you can see we have some very nice titles. And you can build a search. This is a broad search. You can build a complicated search and be very targeted. But you can also go ahead and browse. Browse by subject. And select nursing. And get a look at the nursing specific titles in this collection. Let's look at up to date. When I search in up to date, I just put in a broad term. I don't build complicated searches in here. And immediately I have an overview of medical care in adults with diabetes. Now we could spend an entire session just on a specific database. I just wanted to get you to look at it and get the feel of it. Let's look at Nursing Reference Center Plus. Again, we can search. If I were searching in here, I would put in my topic, and for an overview on a condition, I would select a quick lesson. I also wanted to make you aware of the virtual bookshelf. If you choose More and then Books, here is the virtual bookshelf. All current, highly useful titles. I'll select Diseases and Disorders. And this is in here alphabetically. You could scroll through at the very bottom of the page to find diabetes. Or, the more efficient way, go to the search box, select it, and then use your directional arrows on your keyboard to get to the end. Type in and your search term. And I easily have my entry. That gives you a quick peek at these background resources.
Our next stage would be to formulate an answerable clinical question using the Picot format. Picot is a mnemonic, and it helps us to identify the essential elements of our clinical question. The P stands for patient, population, or problem. Consider who is the target. Consider their disease states, as well as their age, sex, ethnicity, or socioeconomic status. What are their characteristics? I is the intervention. What is your proposed new intervention? It could be a therapeutic measure, or a medication, or a diagnostic test. Or perhaps you're looking to follow a particular exposure, a treatment someone's already had, to see what outcomes develop. C is for comparison. Now, not every question will have a comparison, but you might be considering an alternative treatment to compare it to. It could just be the standard of care or placebo, or it might be a diagnostic gold standard if you are looking at a test. O is for the outcome. What is the measurable outcome being impacted? What are you trying to accomplish here? The T stands for time, the time it takes to produce or observe a clinical outcome. You may or may not see that time element included in your Picot question. It is an element I often see used in the nursing literature version of a Picot versus other health professions. There are different types of questions to achieve different objectives. If your objective is to select a treatment that does more good than harm, and it's worth the effort and cost of using them, then you're looking at a therapy question. If you're looking to identify or select a diagnostic test to confirm or exclude a diagnosis based on considering their specificity and sensitivity, meaning you want to make sure that it's correctly identifying a condition when it's present and not falsely identifying one when it's not. And you also want to consider the expense involved in that test as well as the safety of the patient. We're looking at a diagnosis question. If we want to observe a patient's clinical course over time and anticipate the likely complications of the disease or condition, we're looking at a prognosis question. If we want to identify the cause or possible harm of a condition, we're looking to an etiology harm question. If we want to reduce the chance of disease by identifying and modifying risk factors and how to diagnose early by screening, we're looking at a prevention question. Each of these question types has an associated template to facilitate constructing your question in a fill-in-the-blank style. These are to aid you, not to constrict you, so keep that in mind. Before you begin to search the literature, you want to consider the type of research study design you'll find for your particular question, and that which would be the best evidence for that question. If you're looking at a therapy question, you definitely want to look for that RCT. It's really the definitive way you should answer those questions. However, if you don't find one, then you'd go down the chain of the evidence pyramid and look for the cohort, case control, or case series. Diagnosis questions are usually answered with a prospective blind comparison to a gold standard, which is a type of clinical trial. Or you'd look to a cross-sectional study with all participants receiving both tests. Prognosis questions cannot have an RCT because you've already had an exposure. You may be looking to see if that treatment or disease developed a particular outcome, so you'd be looking to a cohort study or below. Keep in mind that although an RCT can identify a cause or etiology through the course of the study, if an exposure or intervention is suspected of causing harm, then it would be unethical to randomize people into groups using an experimental design, so you won't find an RCT. You'll find either a cohort or a case control study.
Now let's try practicing identifying the type of Picot question and the associated research design. Take some time to read each slide, and when prompted and when you're ready, take the quiz on the screen.
For this question, I would identify the patients as adults with total hip replacements. The intervention is the PCA pain medication. The comparison is the intramuscular pain medication. And the outcome is to control postoperative pain, and the time element is in the perioperative recovery time. This would be a therapy question looking to see which type of medication is more effective than the other in reducing the pain, and the evidence we would want would be a randomized controlled trial. So for this question, the patient would be the infants, and the intervention is the PKU test. The critical thing we're looking at here is the time element, whether it's 2 weeks or 24 hours. And that's where our comparison is. The template was difficult to work with for this question, in my opinion. I don't like to get hemmed in, but it is useful. This is a diagnosis question, and we'd be looking for a blind comparison to a gold standard or a cross-sectional study.
For this question, our P element are patients with type 1 diabetes, and the intervention we're looking at is the blood glucose monitoring 4 times a day, with the outcome of improving blood glucose control. So there is no definitive comparison here. We're just looking at these people monitoring going forward to see if it has an effect on producing an outcome. And the time element would be the first 6 months after being diagnosed. We would be looking for a cohort study or below. In this question, we're looking to study a risk factor for obesity, the outcome, in children or population between the ages of 5 and 18. And that risk factor we're considering are obese adoptive parents. Does that have an impact on an outcome of obesity for that population? I would look to a cohort or a case control study to answer this question. In the next slide, you'll be given a clinical scenario. What I'd like you to do is to break it out into its Picot elements, determine the question type, construct the question, and then decide which study design you'll most likely find in the literature.
For this question, our P element would be a 25-year-old male. The intervention would be the e-cigarette. The comparison would be the nicotine patch. The O would be to quit smoking, and the T would be within 3 months.
We're asking a therapy question
here. And a 25-year-old male smoker is using an e-cigarette more effective than the nicotine patch in quitting the smoking habit. And the study design we would be looking for would be the RCT. This concludes our module. If you have any questions, please reach out and contact me.